My name is Jamie Hartmann Boyce, and I work for the Center for Evidence-Based Medicine at the Nuffield Department of Primary Care Health Sciences at the University of Oxford in the UK. My research mainly focuses on evidence syntheses, so bringing together data from whatever studies are out there, collecting the best available evidence to help people make healthcare decisions. And typically the area I focus on is health behaviors, so behaviors like smoking and looking at weight management and best interventions to combat those. In light of the current situation, I've also been spending quite a lot of time recently reviewing the evidence for various things related to the COVID-19 pandemic on behalf of the Center for Evidence-Based Medicine's COVID-19 Response Service. So in terms of smoking, the data from the COVID-19 pandemic is really still emerging. It's in its infancy, and it's very hard to look into the data we have now and say clearly and with any certainty quantify exactly what the risk to smokers might be and any way that might be different from the general population. There are a couple of issues specific to smoking that make data in this area really hard, and one of them is that it's a characteristic that may not be captured or may be underreported when we're looking at cohorts of hospitalized patients. And that might not be the same, for example, other pre-existing conditions, which might be better documented. So when we think about smoking and its potential role in COVID-19, what we are tending to do at the moment is look at evidence from other acute respiratory infections. And we know from evidence from those that smoking is a risk factor for getting those infections and for those infections having worse outcomes than they might have otherwise. And the World Health Organization has identified smoking as a risk factor for COVID-19. But as I said, the data there is still emerging, and we at Oxford are keeping a really close eye on that to see what patterns might emerge. So a lot of people, I think, in light of this pandemic, are thinking about quitting smoking. And regardless of the pandemic, quitting smoking is the best decision someone who smokes can make for their health. However, it's a very hard thing to do for many, many people, and many people have to try repeatedly to quit smoking before being successful. We know from the evidence available, and I work in quite a lot of Cochrane reviews in this area, that the best way to quit smoking is to use a combination of pharmacological and behavioral support. Now, that may be particularly challenging at this current moment in time, but there are still lots of options available to help people quit smoking. So it might be harder to get prescriptions at the moment for licensed smoking cessation products like varenicline, but nicotine replacement therapy is widely available. We have hundreds of studies that show it's safe and effective for smoking cessation. Nicotine replacement therapy comes in a number of different forms. Most common are things like patches, gum, or lozenges. And what we know from the data is that using two forms at once, using the patch and a shorter acting form like lozenge or gum when cravings hit, is more successful than just using one form. So if you're going down the route and considering using nicotine replacement therapy to quit smoking, definitely consider using a patch as well as a shorter acting form. And that's something you should be able to get from pharmacy, from local stores, depending on where in the world you're based. In terms of behavioral support, we know also that good structured behavioral support can really help people quit smoking. Of course, face-to-face support or group support or support from a healthcare professional indeed might be a lot more challenging and perhaps inadvisable to access at the current moment in time, but there are still proven ways to help you quit smoking in terms of behavioral support that don't involve face-to-face contact. So we know, for example, that text messaging programs, web-based interventions, and print-based self-help interventions can help people quit smoking, as can telephone counseling available through things like national quit lines throughout the world. If you're interested in using one of these modes of support, there's lots of different ones out there, and they are of variable quality. They're not all exactly the same. So the best advice that we would give is to look to government advice and the sources that they signpoint you towards to help support you through quitting smoking. Thanks very much, and good luck to everyone. Take care. Bye.